Glaucoma is one of the leading causes of blindness throughout the world. And the reason for that is there's no pain. It affects your peripheral vision first, so your central vision is spared. And it slowly closes on you, and eventually you have something called tunnel vision. With glaucoma, the pressure in the eyes, sometimes you could have normal pressure as well, but it compromises the optic nerve. So the optic nerve connects your eye to your brain. It takes all this information to the back. The damage happens to the optic nerve, and that's what happens here. So it slowly closes. So your central vision is spared. You feel nothing's happening. There is no pain. I mean, you do get acute angle closure glaucoma. That happens straight away. You get a sudden pain in your eyes. But the more common ones are the chronic open angle glaucoma, where there's no pain involved. So very, very important to have visual fields tests to check your peripheral vision. The visual field test not only checks your central vision, but it also checks your side vision. For example, you're driving, you want to make sure that you'll be able to detect something on the side, like when a car is coming. So I think from that point, everyone over 40 should have a visual fields test. This is the Oculera. It's the visual field tester. We've had problems in the past when people do visual fields test. You've got to put your chin on there, rest it on there, keep your head on the top, your chin at the bottom, and for some of the elderly, it was very difficult. So with this latest gadget, all you do is you put it on, and there you have it. And you have a little trigger button, and you press it when you see these white flashing lights, and within 2 or 3 minutes, it's all done. Reading an eye chart, use your central vision. You're looking straight ahead. With the peripheral vision, you're using your side vision to detect things, even when you're walking, especially when you're driving. So you could have 20/20 vision, but doesn't mean that you have good peripheral vision. And some people actually lose their license based on that. So it's not just your visual acuity or what you could read on the chart, but it's what you could see all around you as well. Glaucoma initially doesn't affect your vision or your ability to read on the chart initially, but when it's long gone, it will affect it. So early detection is very important. The first thing that comes up is the loss of your visual fields, and once we detect that, we refer you on. So we can halt the progression of glaucoma, but we first need to detect it. And the visual field test maps your central vision, your peripheral vision, and if there's minute changes, we can refer you on and save your eyesight. We actually have a blind spot right in front of us, which nobody knows about. But you don't even see your nose, do you? Because your brain fills it in. So this loss could be particularly in one eye, but you tend to do things like move your head. You will change, you will adapt to the situation. So you may think everything is fine, but until you do the test, you won't know. If the damage is not detected early, unfortunately, you are going to lose your vision. Whatever peripheral vision loss you had, we cannot get it back. Once the optic nerve is damaged, it cannot regenerate itself. You've got to follow a trend. So regular eye examination, regular field tests are very important to see if there is a trend. And by doing it all the time, we can detect these minute changes from year to year. Everyone, if someone comes in with a headache, doesn't matter how old they are, the college guidelines is anyone over the age of 40 should have it done, especially people who have family history of glaucoma. If there's any lesion anywhere along that pathway, the visual fields will pick it up. For example, a pituitary tumor, it'll pick that up. you'll get this bitemporal hemianopia where you lose the vision on the top. Again, once again, you don't know, you've lost it. So it's not only eye conditions, but it's also systemic conditions that the visual field testing can pick up.